through tax cuts, deregulation, powerful trade policies, and unleashing American energy, where we're now the largest in the world. We're taking our economy to incredible new heights. Economic growth last quarter hit the 4.1. We anticipate this next quarter to be just an estimate, but already they're saying it could be in the fives.
That was President Trump touting the economy last night while dining with some of America's top business leaders. The president also predicting GDP growth could be over 5% soon. Joining us now is New York Congressman John Faso. He's a member of the House Budget as well as Transportation and Infrastructures Committees. Congressman, good to see you. Thanks so much for joining us.
Good morning. Nice to be with you.
How do you characterize things? Do you think 5% is on the horizon?
Well, I think it could be. The economy is moving forward very swiftly. The stock market continues to outperform expectations. Employers tell me the biggest issue they have is trying to find qualified people to fill jobs. We now have more jobs that are open in the country than we have unemployed people. So investment is taking place. I talk to Main Street businesses all the time, contractors, home improvement people, people working in local Main Street businesses,
right.
And they all tell me that consumers are buying, that they're spending, and that they're more optimistic about the economy.
How are they feeling about the trade situation? The Trump administration announcing that it will, in fact, follow through and impose a 25% tariff on another $16 billion worth of Chinese goods later this month. Trade tensions continuing with Beijing. Is that going to cut into growth?
Well, I think it could. Frankly, there's a dichotomy here. The people that are not directly affected in terms of their business on trade are really, I think, not really paying a whole lot of attention to it. They may start to see price increases, but the businesses I talk to that use steel and other products that are impacted by the tariffs are telling me they're seeing price increases, that they're concerned about it. It is beginning to enter into a level of uncertainty that a lot of these businesses are feeling, and I think this is the risk of the trade policy the administration is pursuing. I'm all for going after China and their misappropriation of industrial and intellectual property,
right.
Their unfair trade practices. But I think that many of the Main Street businesses I talk to are concerned about price increases they're seeing and the impact it'll have on them.
This is Jack Brewer. With you see the economy right now, it's surging. And, you know, the growth numbers, the earnings numbers we've been talking about all day, you see that. If you look back 2 years ago, if you had told me that we were talking 5% growth, I would have told you were crazy. But right now we have a president that actually says that, and I don't know, I heard you said you agree with him, I do as well. How will that play into the midterm elections? Is this going to be a wave that we continue to feel, and will the Republicans be able to have that message resonate in their communities?
Well, I think that's a great question. I think what we have to do as Republicans running for election this year, we've got to focus on the fact that the economy is really humming. People are working. Minority unemployment is at historic lows. We see people working who want jobs, and we're trying to get more people into training and into jobs. So I think that we should focus on the good economy. We should focus on the optimism that people feel, and that's really the strength for the GOP candidates going forward.
Let me ask you about health care. We spoke earlier with Health and Human Services Secretary Alex Azar about the administration's plan to lower drug prices, wondering where that stands. Listen to what he said.
We are, for the first time ever, President Trump is unleashing these Medicare plans to negotiate aggressively, to see if there's where there's competition, to pit drug companies against drug companies to get better discounts, and to let the patients choose which plans are meeting their needs in terms of the trade-off between access and premiums.
Congressman, what can you do here? I mean, this administration, in terms of trying to lower drug prices, do you see the needle actually moving here in terms of lower prices?
Well, the plan that Secretary Azar announced will take place in 2019. I do think that there's a lot of pressure and support for having greater negotiation for Medicare Part B that we're seeing, and the impact, however, is only going to be felt starting next year. I do think this is a step in the right direction. One of the things we have to emphasize, though, is greater price transparency so consumers actually see what these drugs are costing, and that they understand. You have to immobilize consumers to be intelligent and informed consumers so they know what they're getting and how much it's costing. Otherwise, it's going to be very difficult to control these prices. I'd also like to see the administration have more speedy efforts to bring in pharmaceutical products that are licensed, say, in the EU and in other major industrialized countries.
Yeah.
Bring those more speedily into the United States so we can have more competition among drug producers.
Kevin?
Yeah, I think one of the things that we need to focus on is basically the situation with the jobs. I think that's the biggest concern we're having here. And I know we're talking about healthcare, but also most people get their healthcare through their employer. And so it all plays into one. And so changing the Medicare system and the way they're paying for drug pricing will also flow into the private economy and to the employers. But as you mentioned earlier in this segment, you were talking about how, we have more jobs available than there are people to fill those. The JOLTS number yesterday even went up. How are we going to address this? How do we fix this issue where we get people into the jobs where they need the skills training and for those jobs?
Well, I've been one of those favoring, for instance, moving able-bodied people who are receiving benefits like SNAP, food stamps, into training programs and into jobs. We have about 3 to 4 or 5 million people who fit that category, able-bodied, without little kids at home between 18 and 59, who could and should be working. A lot of employers, though, complain about the lack of job readiness skills for their employees. And this is another reason why we need to fix some of the aspects of immigration, such as DACA, so that we remove the uncertainty for those folks in the market so they understand they have a permanent place to work here in the United States.
Yeah.
These all go hand in hand. Fixing immigration, better work requirements for public benefits, and better job training and work readiness for American workers are really key to filling the needs of employers for the workforce that we need.
Real quick, before you go, there was a lot of debate when the tax plan was first put into place about the deduction that New York and so many high-tax states lost. Tell me where that stands in terms of the impact of the loss of that state and local deduction. What impact has it had on New York?
Well, it certainly accelerated the exodus of high-income, high-net-worth people out of New York. That was my concern about that provision.
Right.
But I do think that New York and Albany need to change their tax and spending policies. So I don't envision that this is going to change anytime soon at the federal level. I think the tax bill is a done deal.
Congressman, good to have you on the program this morning. Thanks so much.
Thank you very much.
Congressman John Faso joining us.